I will take this issue first because they will say health is wealth. If we don't have good health, I don't think we can even be talking about the issue of security, because when you're in the hospital, a lot of things can happen. And of course, that's the trending issue of Lassa fever. Lassa fever is an acute viral hemorrhagic fever caused by Lassa virus. The natural carrier of the virus is the multi-mammate rat, but the disease is also spread through human to human transmission. Lassa fever is transmitted from the excreta or urine of the multi-mammate rat. Anyone who is suspected of being in contact with a Lassa patient needs to be presented to the health facilities within a period of 21 days. And of course, the NCDC, that's Nigerian Center for Disease Control, has confirmed the increase in the number of Lassa fever cases reported in the country since the beginning of this year. Now, from 1st of January to 19th, a total of 390 suspected cases are reported. Now, apart from Lassa fever, which is far eating into the country, we have about 4 or 5 states, and we have lots of people affected by Lassa fever. We also have the issue of coronavirus. Now, going outside the shores of Nigeria, I'm sure most have heard of it, the virus which is really ravaging China City. And a lot of people complain about our health facilities being able to tackle this incoming of the viruses. I know that we were successful enough to tackle the issue of the Ebola virus, but there are still comments that we have to wait for it to reach a breaking point, or rather to reach us by the neck, before we strengthen our health facilities. And how can we even prevent this coronavirus? We know that we have lots of transactions from China. So way forward here, I'll start with you, Ayobaji, a way forward after this.
Thank you very much. Before we talk about way forward, issues like this require a lot of mass public enlightenment.
All right.
People have to know what
exactly,
this is,
yes.
And then of course, what are the signs and symptoms to look out for before we even talk about preventive measures. Because if people are not aware, then problems come.
Yeah.
From the science background, a virus is a particular organism that cannot live on its own. It must live inside a living thing, an animal, to be able to be effective. This Lassa virus was discovered in 1969 in a village called Lassa. That Lassa is in Borno, here in Nigeria, but it has since spread to Sierra Leone, Gambia, Ghana, and some of these West African countries. When you have a virus like this, or in some cases, bacteria that causes the disease, we call them pathogens.
Okay.
But for them to be effective, you have what we call the vectors. That is, the animals that they have to enter before they could affect human beings. Okay, as far as Lassa fever is concerned, there is a particular rat that acts as the vector, the one that carries it. So you have to cut off anything that has to do with the feces, the rat, the feces, the urine, and all the rest. That is why cleanliness is, of course, not just next to godliness. This is everything for us. Like you said, we have to be healthy before we can talk about any other thing. The signs and symptoms, fever starts with fever. Then after some time, headache. You still feel uncomfortable. Within 3 weeks, you discover that there are issues with diarrhea, issues of
running nose, cough, and
all those cough, running nose, all those things that are the symptoms. When they come to the fore, that is when they are detected, or immediately you see some of these things happening, you have to go to the hospital for thorough medical
That's
checkup.
Another question again. How many of us go to the hospitals when we find we see all the symptoms? You say you have kata, you say, okay, don't worry, I'll just take vitamin C and salt.
You may not know exactly what. So that's why I started with the issue of mass or public enlightenment. Let people, even in our local languages, let those who have the wherewithal, government, this is one of its responsibilities, come up with maybe jingles. This is Lassa fever, these are the signs, so stop this. So okay, we're asked to be washing our hands, just like it was in the issue of Ebola outbreak. We should be washing our hands, we should keep our environment very clean, make sure that we have no contact with rats entering our houses, they get our dustbins and all the rest, cleaned as quickly as possible, because prevention, of course, is better than cure. By the time, and when it spreads, for instance, you read out the number 300 and something that are affected, and it's spreading. So we have to take more care, but let's start with mass, enlightenment. Let people know what it's all about.
Let me quickly add to what he said as regards that coronavirus and all that. You see, for instance,
I'm not talking about coronavirus.
You find out that in US, a few days ago, they found out somebody that came from China to America and later carrying that particular virus to US. The question now is, me as an airport safety person, how effective is our health port management? Do you understand? Yeah. So these are things that government ought to have been working on even before now. Before now, our port health supposed to have been standardized to the point of screening people while coming in, so that they don't bring in such into the country. All right. So my advice, my take on this is, government should also try as much as possible to make sure that this particular coronavirus, because this Lassa fever we have been living with it for long, we have been containing it and all that. But that corona, as I've been reading it, is like Ebola. So government should quickly empower the port health within our airports, within our land borders, within our sea borders, so that this thing doesn't. And you know that these days we have been having series of relationship with the Chinese people. With the Chinese people. So government will have to be more careful.
Okay, thank you very much. Quickly.
Yeah. Well, the only other thing I want to add to that is that you see how proactive the Chinese government is.
Yeah. Very proactive. Yes, I must commend it.
Yeah.
Budget says Lassa fever started in 1969. Up to today, there's no vaccine locally developed to tackle that issue. Now, China, the Wuhan district, where this coronavirus started in China, is building a hospital in 6 days. Is building a hospital in 6 days
to tackle it,
because there are 830 confirmed cases. 41 people have died. They are building a hospital in 6 days. They have locked up the entire region with about 30 million people. So that is how a government should be. That is how proactive the government should be. We will wait. This coronavirus will come. God forbid, and it may kill more people here.
You know that it's me
than even
in China.
In China, we are not getting it.
All right.
As a people.
Okay, thank you very much. Amici has clearly stated about the proactiveness, or rather the slow pace of the federal government dealing with health issues. Everybody talked about sensitization, public enlightenment. What are they doing concerning? Let people be enlightened about this. What exactly is Lassa fever, coronavirus? Let them know that their health is their wealth. And you talked about the port health, flight safety, people coming through flights. How exactly is our port health safety in Nigeria? Of course, as a science expert or a flight safety expert, they would actually know better.